meant to, I'm not sure what's happening with the slides here, but it was meant to.
I'm sorry, that might have been me.
It was meant to really create a space for veterans to come back and create their own community. And quite often it was self-sustaining. They would, veterans would use, excuse me, Martha, is the dinging in the background? Is there a way to stop that? It's really distracting.
Hopefully that'll do it.
Okay, thanks, Martha. Sorry, I cannot multitask very well. So the purpose was to create a home and community environment for veterans that was self-sustaining. In several of the different veteran homes, they would grow gardens and supply not only the soldiers' home with food for the year, but also the community. So it was really kind of a place where soldiers could come back and just live amongst each other and really support each other. It wasn't a medical model. It was quite opposite of that. And that's kind of how our country went into first starting taking care of soldiers that were returning. Some of the soldiers' home required veterans to surrender their pension. And what they got in exchange was meals, a warm place to stay, clothing, and other basic necessities. Generally, the spots in the soldiers' home were reserved for veterans that weren't doing well financially. I know one soldier home in particular from where I'm from up in Washington State. They first opened up in 1891, and they did require veterans to surrender their pension, and usually the pension those days were about $12 a month. And so, to give you a little bit of idea, the first person to run that particular soldier home, he had $1,000 a year salary. Throughout the history of soldiers' home, after they were first created, they underwent several changes. Starting with a lot of soldiers returning from Civil War and World War One. They started incorporating infirmaries on the soldiers' home, so that's when it started becoming a little bit more medical to attend to amputees and other injuries that were sustained while serving over in a combat zone. Really, that was the system that was largely responsible for preventing homelessness among veterans back in the day. A very social kind of model, very normalizing, not a whole lot of medical interventions. When they first were opened, doctors would be put on contract to come do home visits, and they received a fee for every home visit they did. But that's really kind of the start of, that's what it looked like at the very beginning, is just doctors making visits to the soldiers' home versus living there and working there and all that stuff. Let's see if I can figure out how to go to the next slide here. So the VA, fast forward to today, the VA and the community addressing housing needs for veterans. So in 2009, I'm sure most of you are familiar with the pledge to end homelessness that was announced by, at the time, Secretary of State Shinseki and President Obama. At that point in time, there was 154,000 homeless veterans living on the streets. So the VA already had some programs to address homelessness, but it wasn't intentionalized, it wasn't streamlined, and it wasn't well resourced. Traditionally, the VA has been a medical center and a hospital, and not really focused on community and homelessness in a large, expansive way. So what the VA did, they started leveraging existing programs like Grant Per Diem, which is a transitional living situation where the VA contracts with community providers, and they provide a place to stay for veterans and food and employment assistance, things like that. They expanded their programs and created rapid rehousing and housing prevention program called SSVF. They also entered into a lot of contracts to really help keep veterans who are struggling with sobriety, struggling with following rules that many of the transitional programs had. So those were considered HHV contracts, where they would provide, where community providers would provide safe haven programs and harm reduction programs. And really the VA took, at least locally here in West LA, I can speak for, took an approach that was very different from what they were used to. It used to be a very sobriety first approach to housing, and they became a housing first, where the primary goal in all cases was to get housing and to address any needs that might prevent them from staying in that housing. And currently there's about 35 to 38,000 homeless veterans on the street across the United States. And in Los Angeles alone, there's currently 4,000, a little bit under 4,000, according to the last point in time count, which was conducted late January of this year. Nationally, homelessness would have dropped 3% in 2017 without Seattle and Los Angeles, but because of Seattle and Los Angeles, national homelessness for veterans rose actually 1.5%. That was 2017. I haven't gotten the statistics for 2018, but just to give you an idea of the magnitude of homelessness in both Seattle and Los Angeles. So CES, some of you might be familiar with CES. It's a coordinated entry system, which was really kind of pushed out as a national mandate and incorporated locally across the United States. And it's really kind of a point where you can refer homeless veterans and non-homeless or homeless non-veterans to. And basically, you go through what's called a SPDAT, which is a vulnerability index screening tool. And then at that point, they're matched with resources in that area. So the VA has incorporated CES locally. I'm not sure about nationally. And there's a close collaboration between LA Homeless Services Authority, who runs the CES here locally, and the VA. There's several major LA County initiatives to serve homeless veterans. We, as taxpayers, a year and a half, 2 years ago, we passed Measure H and Measure Triple H, and that provided a lot of funding to address homelessness. And the Board of Supervisors have used some of that money to focus in specifically on veterans. And they started with an outreach program that was outreach and benefits. So really to find veterans who might not be eligible for VA services and help them with service district upgrades, help them become eligible for VA benefits, help them with SSI claims, things like that, so they have an income to live off of. Trajectories into homelessness for veterans. So OIF, OEF, and OND. OIF is Operation Iraqi Freedom. That was all services, all combat operations related to the war on terrorism after 9/11. And then OEF. OIF was specific to Iraq. OEF was specific to Afghanistan. And then OND in 2010, when we halted combat operations in Iraq, it went from Operation Freedom to Operation New Dawn. And so what that really kind of entails is, like, veterans, as they're getting out of the military, whether you've been to combat or not, generally don't plan. I've seen some reports out there, I don't remember the data, but that tends to be a huge problem for veterans as we're getting out of the military. We just, want to sign the paper, tend to just want to, not be told where to live anymore, what to wear, and we don't always plan ahead. And so that can really turn into, failure to project financial situation, such as, you get used to. As an E5 in the Army, I was making close to $3,500, $4,000 a month. So with the housing allowance. And so that's a steady income. No matter what happens, no matter how sick I get, no matter I get paid that amount, and my family gets used to that amount, and also gets used to having all the supports that you get in the military life. And so when you suddenly go from that to living on a GI Bill, which gives you about $2,100 a month, and student loans, you can see how tumultuous that could be for a lot of veterans. Or another pathway is to go on unemployment. And so underestimating the job market, a lot of veterans find out that it's a lot more difficult to get employment and hit that bump in the road when they get to it. So failure to project financials can create, as you can guess, creates a lot of other things to kind of spiral down for veterans, such as their relationships. And as that stress piles up, their ability to focus in school. If you drop out of school, then you don't get the GI Bill anymore. So it really kind of leads to a lot of issues for recently returning and exiting service veterans. And then with the chronically homeless, there's oftentimes no resources, or they've been promised resources in the past and really haven't had those organizations come through. Prejudice in the hiring practices. There's not been a lot of attention in the media about it, but working on the ground with veterans, you often hear that as soon as I told them I'm a veteran, they could tell that the interview shifted, and that was a barrier to hiring because of a misunderstanding of veterans. So there's a lot of efforts out there as far as educating HR staff, working with HR staff, augmenting EAP programs to assist veterans so they don't fall out of employment. We talked about family conflict. Really, the whole family's adjusting. If you have a family while you're in and you get out, it's not just you adjusting, it's your family adjusting. You have a lot of support in the military. You have FRG, which is the family readiness group that families can participate or not participate in, and that they usually host events, and it's kind of a social gathering. You have everything that comes with the military. It's like its own society. And so losing that for not just the veteran, but for the family, that can create some issues with adjustment and potentially some conflict. Spouses in the military, they often give up their professional careers to support their veteran. And so that often leaves spouses at a disadvantage when you do leave the military. So there's a lot of areas where there's a lot of adjustment, and a lot of veterans handle it just fine, but a lot of veterans also experience a lot of difficulty in making that adjustment. And in LA in particular, and I'm sure this is elsewhere, but failures to appear. So being overwhelmed, coming back, not appearing to court when you're summoned to court, that leads to losing your license, which leads to losing your employment. And it really creates a severe downward spiral for not just veterans, but non-veterans. So military culture with homeless veterans. This is probably one of the most significant walls that can prevent folks from connecting with homeless veterans, is not understanding the military culture, especially with the younger population, with the older population as well. But with the younger population, very mistrustful and quick to disengage in seeking help. So embrace the suck. That's really something we heard a lot in the military, as far as, this is the mission. This is what you're supposed to do. This is what you're ordered to do. So just embrace it. Otherwise, it's going to be difficult. And that creates a lot of resiliency for veterans. So that's one aspect of military culture. Also, one aspect of military culture that I've seen create some barriers between non-veteran clinicians who don't have a full understanding of military culture and the veteran is our use of dark humor and a lot of jokes. The theme is around death, and so that can really be a significant barrier. Also, the intolerables for veterans, from my experience, has really been one, getting vulnerable and disclosing and opening up, and another one, and the other one is a sense of helplessness. It's really two very intolerable feelings for veterans. That's difficult across the board, but specifically difficult for homeless veterans or veterans because we get trained to take action. We get trained to accomplish a mission. Helplessness is very foreign. It goes against all our training. It goes against our mission. It goes against how we see ourselves in the military. It goes against how we see ourselves as veterans. So situations to where we feel helplessness, it's very, very difficult. In vulnerability, you really have to put on a strong front. And there's a saying that's fake it till you make it. Also, something that contributes to the to vulnerability being extra intolerable for veterans is the fact that it's about the group, it's about your unit, and it's about the mission. And there's no place to be an individual. There's no I. So to show vulnerability is to hold your unit back and prevent it from accomplishing the mission, and putting attention on yourself, which is very not respected in the military. The military culture, we're very competitive, and we do a lot of comparing, much to our detriment once we get out. We're taught a lot about military history, as far as the Army, as far as each branch, all the way down to like our specific units, the history of our units. And so there's a lot of history that's incorporated, a lot of pride. And with that comes, a competitiveness, like it's Alpha Company versus Bravo Company, who can run up the hill quickest. Everything becomes a competition in the military. So, once we get out, it's very similar. Managing a large team of peers doing outreach, I experienced that it got very, very competitive as far as who could see the most veterans, who could bring in the most veterans for help, things like that, which wasn't always a healthy side effect. Comparisons, he was infantry and I was just support personnel. That's one form of comparison. Or, their unit was through the worst and mine just did operations around the green zone, things like that. So it's very, there's a lot of comparing going on, and you can see how that might affect veterans once they get out, especially around trauma work. So the unique role of a veteran is a peer support. So service as a veteran adds another significant dimension on top of the shared lived experience that we all have as peer support. Much like the addiction world, you get a lot of, if you haven't been through it, if you haven't used drugs, how can you even understand where I'm coming from? And there's a lot of similarities with veterans. It's kind of an experience that is extremely unique, and it's a good point. It's if you haven't been there, you don't know what it's like, but it doesn't mean that you can't help. So recovery versus reintegration work, this is kind of how I've made sense of my work the last 4 years with peer support in the veteran realm. Recovery is very, once you become part of the system, that's the recovery work. You're working on recovery plans. You're talking about different stages of crisis, things like that. Reintegration work is more out front before somebody even becomes part of the system. It's really more outreach, information sharing, triaging, And really the emphasis of the shared experience is really on the military service versus the diagnosis to prevent people not identifying with that peer support and the approach. Veteran versus service member mentality. So, you know, when you're in, I talked a little bit about how it's all about the team, it's all about your unit and history and things like that. When you get out as a veteran, it becomes all about you. It becomes about you taking care of yourself, you filing for disability if that's an option, you filing for your GI Bill, where it's complete opposite of when you're in. And that makes it really difficult for a lot of veterans transitioning out of the military. And so the mentality becomes very, very different. And depending on the individual's ability to adjust to that, it can be very difficult. Veterans helping veteran challenges. You know, when I first started, I graduated in 2010 with my MSW, and right away I started doing trauma work in a residential facility for Iraq and Afghanistan veterans. And I'd heard a lot of people say, "Oh, it's going to be great. You're a veteran and you're an MSW, so you're going to have a step ahead of those who haven't been a veteran and haven't been overseas." And as I got to working, I realized that that wasn't really true. I had to deal with some views that I developed as a veteran that if I wasn't a veteran, I wouldn't have developed those kind of expectations on those that I was serving. And with the trauma work, really kind of getting into the trauma work with folks, I realized that I still had a lot of challenges myself that prevented me from being completely present in the moment. So, and I've witnessed this throughout my 8 years of being an employer and working in the field, is that, a lot of veterans, while, the relatability is there, it brings a whole nother dimension to helping other veterans. And same with peer support. It really, I think what I've seen the most is, I didn't become a peer support to not be able to help my fellow veterans. And so, if we didn't have that veteran history of being a veteran, helping a veteran would be easier because you don't have that strong emotional piece that goes with that. So engaging a veteran, when you're engaging a veteran, the best way is just to be curious. This is how I explain it to everybody. You don't have to have served to be curious about somebody's service. Asking things like, what was your last unit? What was your duty station? How long did you serve? Did you serve in any theaters of combat? I think the most significant question that really kind of gets people to, gets fellow veterans to light up, or veterans to light up, is really, what did you do in the military? What was your job? In the Army, we called it N.A.P.S. I think one of the other branches, it's called A school, and Marine Corps is SOI. But really getting somebody to talk about what their job was in the military and getting really curious around that piece, because that was our job while we were in. And for the vast majority of veterans, that was what we did for several years. So, we take a lot of pride, like we talked about before, in the military culture. There's a lot of pride that's ingrained in us, all the way from the history of our branch, all the way down to the history of our unit, to, our company being the top company in the brigade. As far as PT scores, like, everything is a competition. Everything's about pride. So when you're engaging a veteran, think about how to really tap into that person's pride. And it doesn't work for all veterans. Some veterans had a really rough time in the military, and they might not want to identify as a veteran. Or for a lot of women veterans, they don't see themselves as a veteran. And so a lot of questionnaires are around, have you ever served in the military versus are you a veteran, in places like community colleges, things like that. So that's something to keep in the back of your mind when really kind of trying to engage the female veteran population. And helping establish a healthy veteran identity. Some of us, when we get out, we want to wear Marine Corps shirts, Air Force hats, really want to make sure that everybody knew that we served, because when we were in, our uniforms pretty much said who we were. It's like a resume. We wore a resume. Like, if we did Ranger School, it was on there. If we did Special Forces, it was on there. If we did Jump School, it was on there. If we did Combat Medical Lifesaver course, there's a badge for that. So your unit's on there, the American flag's on your uniform. So that, just because somebody a veteran wears a lot of stuff doesn't mean they over-identify as a veteran. It means that they really, maybe it meant that they really enjoyed that aspect of the military, wearing the uniform and having that sense of pride. So for peer support with veterans, to really get in there as a peer support and find out what it is that drives a veteran. Is the veteran stuff incorporated in a healthy fashion for them, or is it something that they're still dealing with the grief and loss of losing that uniform, losing the camaraderie, losing all that stuff in the military? So really kind of getting in and talking around how veterans identify, how they maintain their status as a veteran is really important work as a peer support that is unique to veteran peer support. Looking for a next slide. So that's it. Martha, do we have time for questions?
Yes, so what we can do, what I'm going to do is allow people to unmute themselves, I hope. Let me hear. So we had a couple of questions in the chat. One was, are there stats relating to the intolerables in relation to suicide rates of veterans?
But no he's not allowing backpacks in his place at all.
If you're talking in the background, you're unmuted now.
Wondering, now I'm kicking myself for taking out,
All right.
I thought, oh my God, we would never have these problems. Taking out the whole counter, because the counter.
All right, so everyone's going to be muted, so you'll have to use the chat. So can you hear me, Jim? The question, are there any stats relating to the intolerables and suicide rates?
No, there isn't. The intolerables is just from my anecdotal experience, both as a veteran and as somebody that's worked with veterans the last 8 years. Really, I think the best theorist with data that I've ran across is, and of course his mind is Thomas Joyner. Really, when you're feeling like you're a burden to your family and friends and everybody around you, that's a significant indicator. If you're re-experiencing a lot of violent and traumatic experiences, that's another indicator. And then, of course, access to firearms and other lethal means. Those are what he's found out through his research over the many years has been the three largest indicators for veteran suicide, and that's something that really guides my practice today is honing in on those. But really, if you think about it, the feeling like you're a burden to others, it's really a sense of helplessness and hopelessness, in my mind. And that, there's no stats, and I haven't read that anywhere, but that's kind of an association that I make is, when you feel like you're a burden and you're not able to change your environment, then it's a sense of being helpless and hopeless. So
Great. And there's another question about how hard would you say it is based on pride for a veteran to admit being a substance abuser or addict?
That's a great question. That is probably the most stigmatizing aspect of in the veteran community is substance abuse, around substance abuse. Really, it's viewed very strongly as a lack of discipline. In the military, we're taught, upon a lot of the discipline, like physically, we're also taught a concept called military bearing, maintain your military bearing. And that's really, don't get out of line emotionally, don't blow up, when you're in public, maintain your military bearing. When you're in front of the wives and husbands, maintain your military bearing. So discipline is not just a physical thing in the military, it's also an emotional thing. And so you're expected to have control over everything. And so, as a veteran, it's seen as a lack of discipline or a weakness. There's some commonalities across, non-veteran population as well, but it's very amplified with veterans. And that's probably the hardest thing to kind of break through folks' pride as veterans, to get them to maybe explore the fact that they might have a problematic relationship with drugs or alcohol.
Thank you. The next question is, are there any veteran homes still in use?
Yeah, there is. The one that I referenced from where I'm from, up in Washington State, there's the old soldiers home in Ording, Washington. And right now it's ran by the state, as I think most of them are ran by their respective states. And that one is actually looking to enter into agreement with a nonprofit to provide social services there. So that one's been alive and kicking for a long time, and still today. I'm not sure of all the different soldiers home across the country, but I know Ording is not the only one.
I know in Massachusetts we have two pretty large soldiers home, one in the Boston area and one in Western Massachusetts. There's another question. What kind of access to mental health or substance use services do most homeless vets get?
So currently, there is the biggest program that the VA is operating right now to address chronically homeless veterans is the HUD-VASH program, which is a partnership through the Housing Urban Development and the VA. And VA provides the wraparound services, which is basically social workers and peer support, nurses, nurse practitioners that actually go onto the street and work with veterans to get them into permanent housing and wrap the services around them versus them having to come to the actual VA. That's the most significant one. And I lost my train of thought there. But that for sure is the first go-to for the VA and for veteran homelessness across the country.
This is a little bit of a follow-up on that. Does the military offer education and options to veterans to stay in service who become addicted to pain medicine that is prescribed for injuries or mental health issues?
No, that from what I hear, the military is getting a lot better around making sure that folks get treatment before they get out. But really, during my time of service, 04 to 08, if folks did become addicted to pain medication as a result of getting medevaced out of country, really the military looked at those soldiers at that time as a burden on the system. One thing to understand about active military is that their mission is very different than ours as helping professionals. It is to defend this country against all foreign and domestic threats, and so they everything is really wrapped around that mission. So taking care of people, as you can imagine, medically for an extended period of time is a drain on resources that the military has not really done a lot about in the past. But from what I hear, it's getting a lot better, specifically around the time before you discharge from the military. They're taking a lot more time. In the past, it was a 3-day outbrief, and local PDs would come and recruit you. Border Patrol would come and recruit you. Various other employers would come to recruit you during that 3-day period. But it was a 3-day period. Now it's becoming a much more intentional and longer process from what I hear. I hope that answered your question.
Just so people know, I will keep all these chats and we'll try to answer questions we don't get to, but I'm just going to go through them as they come. How would you help a veteran to open up when they are always told not to air their dirty laundry to others, such as the chaplain or psychiatrist?
Yeah, so it's really about being consistent and being reliable. In those cases, I usually, it's one of the many reasons why I love working with peer support, because in that scenario, I really think it sounds like that individual is really kind of still very much living through the military lens. And so connecting through military experience is really optimal in that situation. But, on top of that, you have to be very consistent and you have to be very reliable. Because, a lot of us veterans are very mistrustful, given that, you could rely on pretty much everybody in the military and you were expected to, or else you were an outcast, you were an individual, which was not embraced by the military culture. So that's how I would answer that question.
Right, and the next one is, are veterans as a group more loath to seek entry into the homeless service system? And is there any way to utilize peer support in outreach to encourage more veterans to seek out services?
That's a great question and a great idea. So they do. From what my experience here in LA has been that, especially among the Vietnam veteran era, they're a lot more comfortable living in the woods. There is woods in the LA, but living in the woods, living together as a community, just because in the military, you get used to living in adverse environments. So I think homeless veterans, especially the Vietnam veteran era, are much more hesitant to enter the homeless entry system versus somebody who hasn't served. And as far as using peer support for outreach, I see LA really doing a lot around that. At the VA, when I was working there, we were actually converting all our what was called SST positions, which are traditionally who our outreach were, to peer support. And really looking to ramp up training around how to conduct outreach as a peer support specialist and tailoring some of that. Tailoring some of the training specifically to how to do that job. So that's a great idea. And with LA County Department of Mental Health, we're looking to create a veteran peer access network where we would contract out to different nonprofit agencies across LA County to form a peer access network and make sure that they had access to not only LA County resources, but also leverage our relationship with the VA to make sure that there was access to the VA should these peers run into veterans on the street that maybe have been resistant to coming in the past, are now willing. And our job as administrators is really to make sure that when that opportunity presents itself, those peers have the ability to navigate the system quickly and consistently. Otherwise, we're going to lose those veterans again.
Thank you. This is a comment and a question from a couple people. I'm going to try to combine into one. A comment that there's often providers, PhDs, nurses in ERs that belittle veterans that are coming in for detox, which is a world of misunderstanding. And a question about, Can you address the attitude of providers who strip veterans of their pride by statements like, you are not in the military anymore, you were whatever your rank or job was, you are not that now?
Yeah, so you know, I've seen that pretty much every place I've worked, and really it's a lack of understanding or burnout is the way I kind of look at it. And really I like to listen in, ask questions, and figure out you know, which of the two it is, because my approach with folks is going to be different depending on whether it's a lack of understanding or burnout. But needless to say, it's very destructive in the help-seeking process for veterans, because the most reliable, the most listened to source of outreach for homeless vets is hearing it from another homeless vet. And if a homeless vet is sitting in an emergency room and detoxing, and they're hearing that kind of language, then, you know, of course they're going to tell their buddies when they get out, and that's going to create even more mistrust for providers. So really, when you hear that, you see that, you know, my approach is to address it immediately, but not just approach it with a one size fits all, but really kind of find out where that's coming from. And you know, in some cases, it's just not the right population for people to work with, and at that point, it becomes a conversation about you know, is this the right fit for you as an employee? Because we're not going to tolerate this kind of these kind of comments being made. So that's you know, it's very rampant. I'm glad you brought that up. It's very important, and
I think this is one place where we're starting to see change now. I know here locally, we're starting to get more peer support and recovery coaches, both in ERs and in hospitals. But it's few and far between. There were a couple of questions about military sexual trauma, and about how to open the conversation. And one, especially women who may have experienced sexual assault and do not talk about or acknowledge they've experienced any type of abuse by peer counterparts while serving. So how to open the door to military sexual trauma conversations.
yeah, you know, I gotta say out front, I don't have a whole lot of experience working with military sexual trauma. You know, from what I've heard from peer support who have shared their story, and a few veterans that I work with that opened up and disclosed military sexual trauma, it's much more insidious, because it's you know, you really develop a us versus them, especially if somebody's experienced a combat deployment, because your very survival depends on it, and your buddy's survival depends on it. And to be betrayed by somebody that is part of that, as you're, you know, really adjusting to this us versus them, it can be very insidious for folks. And I'm mindful of that, and I generally my approach has been to just, you know, make the person feel as comfortable as possible, and then it'll eventually come out. But I know that there's folks that do a lot more work with MST that'd be a much better fit to discuss this topic. But you know, it's very, very insidious for those that don't have experience working with somebody with MST. It's the ability to trust is completely shattered, versus different aspects of trust. And so that's been my experience. And I'm sorry I don't have more to say on that one, but it's you know, it's something that I just haven't dealt a lot with.
All right, we have a question. Are there any best practice suicide prevention trainings for peers?
So my what I've used is Assist, the 2-day training. We offer it here at LA County free of charge. Any agency can request our trainers to come out and provide the training. But so far, that's the one that I found that I like the most and I use the most. just because it talks about alertness, it talks about proper handoff, and as peer support, I feel like it fits our scope of practice the best.
Thank you. One thing that we have here in Massachusetts, and it's in a few other states, it's not really what I would call suicide prevention training, but we do alternatives to suicide groups, which are peer-run groups, usually not connected to any clinical entity, but it allows people to talk about things they've been silent about without fear of what will happen. And that's been very helpful to me. I think it saved my life. I've left this slide up here with Jim's contact information, his email. And I'm going to go through back here to the end of the slides. And again, I wanted to thank Optum for their sponsorship of our ongoing webinars. And let me get back to this first one. There. So this is how you can get a certificate. And this is also if you have questions that weren't answered, or any other questions or comments about the webinar, if you email me at membership and it's INAOPS.org. Any questions, any comments, or to get a certificate. Just looking here at the last, a few people commented about assist, mental health first aid. One other question that came through, Jim, does disfigurement or amputation during combat change peer dynamics?
Yeah, it definitely does. We talked a little bit about like the layers of loss when you leave the military, from the uniform that you wear with all your accomplishments on it to your brothers and sisters who have your back, whether you're going out to have a good time on weekend pass, or you're dealing with a leader who's not the nicest or the most professional. But you lose that sense of it's really kind of a family feel. And so for those that lose a limb and get taken out of the fight, as many will explain it to you, that's a loss. Like I'm no longer on the front lines with my buddies. I'm not contributing. The inability to serve, and for those that are never able to get back in and you stay in, but to return to their unit, they can't return to their unit. I've worked with a lot of veterans who they wanted that to be their career, and as a result of their injuries, they weren't able to continue on, and they spent more time talking about that than about their Humvee getting blown up and their buddy dying. It was a lot about, not being able to, what am I supposed to do now? I put all my eggs in that one basket, and that basket isn't there anymore. So it absolutely does. And it really becomes more of an issue of grief and loss on top of extra adjustment issues, rather than adjustment and trauma stuff, which is more than enough, but it makes it very much more complex. Not to mention any of the physical treatment aspects and dealing with that end.
Well, I want to thank you very much, Jim. And I actually just received a new report that shows veteran suicide rates, and I'll post that on the N.A.P.S website as well, on the webinar page, on the announcement for this, if people want that. I'm afraid if I try to transcribe it, I'll mess it up. But I want to thank everyone for attending, and please, any comments or questions, please email me. And we had about 88 people on at one time, and so that's really great. Just people, are working with veterans in the VA, but a lot of people not working in the VA system also encounter veterans, and so this is important for all of us. So thank you all.
Thanks, Martha. Thank you, everybody.
All righty. I'll leave this up here for a little if people are trying to copy this down.